Introducing skin cancer. Elizabeth Bowens and I'm Tanya Crawford, Jamie Perkins, and Karen Rowley. First, objectives. To be able to discuss the forms of UV radiations with 90% of accuracy, explain the causes of various forms of cancer with 85% accuracy, describe cancer with 90% accuracy, define how to detect cancer with 85% accuracy, integrate signs and symptoms, and develop a plan of care with 85% accuracy. Next, with the objectives is to be able to identify risk factors with 85% accuracy, demonstrate understanding with 85% accuracy, be able to recall the history of cancer with 90% accuracy, compare prognosis with 85% accuracy. Next, you will be able to give examples of ways to treat skin cancer with 90% accuracy, explain ethical impacts of skin cancer on the patient, the family, and society with 85% accuracy, and next, summarize pathologically with 85% accuracy. Skin cancer is the most common type of cancer. Half of all prognoses are skin cancers. Skin cancer is divided into two categories, non-melanoma and malignant melanoma. And the non-melanoma is basal cell carcinoma and squamous cell carcinoma. The incidence of skin cancers. 80% of non-melanoma skin cancer are basal cells. 20% of all non-melanoma skin cancer are squamous cells. Malignant melanoma is the least common skin cancer. Risk factors for skin cancers are fair complexion, blue eyes, blonde or red hair, working in direct sunlight, radiation for past skin cancers, chemical exposure, scars, damaged skin from chronic osteomyelitis, fistula opens, immunosuppressive therapy, genetics, irregular moles, which are multiple, congenital nevus or moles, or HPV. All right, the next one is basal cell and squamous cell cancer. Basal cell skin cancer are located at the basal layer of the epidermis. This is the most common type of skin cancer. Squamous cell skin cancers are located at the epidermal layer of the skin. Basal cell carcinoma and squamous cell carcinoma often do not metastasize. But of the two carcinomas, squamous cell carcinoma is the more likely to metastasize. Basal cell carcinoma is a slow-growing cancer. If diagnosed early, this type of cancer is easily curable. Diagnosis. The basal cell carcinoma lesion typically begin as a small nodule, purely in color. Borders are translucent. Sometimes can be crusted. Sometimes appear as an ulcer. If not treated, complication may occur. The complications include hemorrhaging of surrounding tissues. Infections can also occur. Cosmetic abnormalities and possible disabilities of an affected tissue when occurring around the facial features such as the ears. Basal cell carcinoma can cause complications of the muscle, bones, dural matter of the brain. It is the most frequent occurring skin cancer. High risk include blonde or red hair, fair skin, green, blue, or gray eyes. Prognosis is good for basal carcinoma if it's treated in a timely manner. The reoccurrence risk is 44% within 3 years. All right. Treatment is based upon the size, the type, location, and the depth of the tumor. Excision biopsy, 95% of no reoccurrence. Cryosurgery, 85 to 90% of no reoccurrence. Photodynamic therapy is 70 to 90% of no reoccurrence. MOA, micrographic surgery, is 99% of no reoccurrence. And radiation is 90% of no reoccurrence. And that is a basal cell carcinoma. You want me to do it again?